Welcome back. Well, COVID-19 has demonstrated stark social and economic inequalities with vulnerable and marginalized groups such as the LGBTIQ plus community, persons with disabilities, women and children being disproportionately impacted. According to the Mental Health Foundation, members of the LGBTIQ plus community are more likely to experience mental health problems than their heterosexual counterparts. This is reportedly due to discrimination and inequalities in society, among others. Also, the Human Rights Commission says the LGBTIQ plus community is more likely than the general population to live in poverty and lack access to adequate medical care. Now, to talk to us more about this, we're joined via Zoom by Dr Dulcee Rakumakwe, the founder of QueerWell, a non-profit organization established to provide psychosocial support to the LGBTIQ plus community in South Africa. Doctor, pleasure having you on the program.
Good day, Blaine. How are you doing today?
I am better than I deserve. Thank you very much indeed for taking the opportunity. Firstly, tell the viewers more about your organization and the support it provides for LGBTIQ plus individuals here in South Africa.
Thank you, Blaine. So QueerWell is an organization that we launched towards the end of last year and officially in March this year, to provide access to mental health care and support to the LGBTIQ plus, community. As you say, Blaine, our community faces, like many mental health issues, including but not excluding others. Like there's a lot of depression, there's anxiety, substance abuse, and a lot of the community members do not have the support, that like our heterosexual counterparts would enjoy, like from family, from the community. There's a lot of discrimination, in different spaces, in the workplaces, in schools, in the communities that people live in. People are under threat of violence. Sometimes the violence does occur, and this obviously makes many of our people anxious, makes many of our people depressed, and some of them do not have the support that people would get at home. And when you talk of access to the services, it's a big problem. Like you say, there's poverty in the community. A lot of people lack access to economic sources, to jobs, proper jobs, proper financial support. Some of the time the issue is access to existing mental health care services, especially in your townships and rural areas. And also many of the people cannot afford these services. But what we also found was one of the biggest barriers to access are the provider attitudes. How people are received when they try and access even just general healthcare services in clinics and in hospitals and even in private practices. People are met with discrimination. Some of the providers are not sensitized to be able to provide good care to members of this community without discrimination, without ridiculing, without making people feel like they don't have a right, to exist. We see this a lot also in trans, communities where people would be misgendered and not be received well by the providers. So what we do as
carry on, Doc.
Yeah, so what we do as an organization is we organize workshops in these communities to teach people about mental health care, mental support is out there. We contract psychologists and counselors and therapists to work with us in the organization, and we obviously target either practitioners that are queer themselves or queer sensitized and non-discriminatory to make sure that our people are getting the care. And because of COVID as well, worsening the mental health issues in the community, but as well restricting access even more to services. We found ourselves, having to do sessions like Zoom sessions. We do telephonic consultations, WhatsApp video, interventions, especially when we would be contacted by people who are really in distress and needing, urgent attention.
It is important, no doubt, indeed. This mental health care and support, is it free?
It is free. It is free to our communities. That is why, we're working very hard to try and raise funds for the organization. 2 weekends ago, we had an event in Braamfontein where we invited different queer performers and DJs to volunteer their services, and we had a big party where people were donating 150 rand to come in, and these are some of the initiatives that we do to try and raise funds. We also put out our bank details through social media and our website to ask people to donate. We also now applying to donor or funder organizations to just try and get funding so that we can have a proper center, proper facilities where people can come in and receive the assistance and have the organization really properly administered. So currently we're just relying on those donations and taking money out of the pocket, and being lucky enough to get therapists who are willing to see people at discounted rates, and this has allowed us to so far help more than 1,000 people. Since we launched, we have helped more than 1,000 people because people are really just reaching out, and we finding ourselves reaching people even just outside Gauteng or even outside South Africa. We have patients calling in from Kenya, Mozambique, and places like that because the services are really needed.
So you, as an organization, are helping those who are struggling to cope. What about your organization? Are you coping financially?
No, not at all. That is why I'm saying, instead of waiting for donor funding, we've been doing the little events. We'll have a car wash event towards the end of the year as well, just trying and raising funds so that we can be able to sustain ourselves while we're waiting for an international funder, or a big funder who can really assist us.
I was just reading your statement, and you say that there's been a great increase in people with psychological problems coming in. Tell us more. What have you observed?
What we've observed with COVID is, yes, many people lost income, for one, with the restrictions, especially at your level 5 and level 4, where people had to quarantine or isolate, in their homes and not interact with other people. That caused a lot of strain. Some of the people were forced to be locked down, in families that are generally not supportive, where in families where which are really triggers of some of the mental health issues that people have. And under normal circumstances without COVID, when people are able to move around, go to work, socialize, people tend to be able to escape somehow, from some of these issues. But now, during this period, we found that a lot of people were forced to really be in touch with their mental health issues, and plus the fact that some of them could not access their normal practitioners where they would go for assistance, that caused a lot of strain. But one of the biggest things we saw was just people having lost income, having being really faced with poverty type issues. People had no access to food. People had no access to electricity, data, and just general things, that would help them cope and survive.
Yes. John Jeffries, the Deputy Minister of Justice and Correctional Services, spoke to SABC News recently, and he said hate crimes against members of the LGBTIQ plus community are still very prevalent in our society. Is that your finding as well?
That is what is going on. That is what we're seeing in a lot of the people that we we assist from the rurals, especially in the townships. Hate crimes are still very rife. We just I think we're just finishing the 16 days activism, for GBV, but the GBV that is happening to our community members is really quite saddening and rife. People are still being killed. People are being assaulted in public spaces. People cannot socialize as normal people would in a community because of their sexuality, because of their gender presentation, because they are transgendered. It is happening quite a lot. So and people because of that, there's very high levels of depression and anxiety, and that is some of the cases that we've seen where people had been raped either by family members or community members members, some of them find it difficult to report because of the type of treatment, again, they would receive in police stations because of how they are presenting, like either gender-wise or sex or sexuality-wise, and like that is a really big problem. So like, with our role has been more on the mental health, but we've found ourselves, having to reach out to some of the organizations that deal with violence and helping people with that,
Right. Doctor, it's so important to have these conversations, and not only once. We need to have it continuously and on an ongoing basis to flesh out these issues and bring it to the fore. No doubt. We thank you very much indeed for your time. Be well.
Okay, thank you. And people can please visit our website, queerwell.org, and just donate from that website if they can, please. Thank you so much.
Dr. Dulcee Rakumakwe, the founder of Queerwell there. It is 1 o'clock. Let's get a check on the headlines.